Today's guests are Leuner, and Danielle Moroux. We joined their conversation in the faculty lounge.
You had to make them, or how did they get them?
No, we had them available.
You did?
Yeah, we would. We definitely would. There were companies at the time that were making the devices and stuff, and yeah, it's a big industry now.
That's
it's
interesting.
A huge industry.
Yes. Now that was a while ago. So have things changed? Do you know over the years, or you've sort of moved into other directions? So
I've pretty much moved in other directions. I really don't know what the devices are now. I know that. I mean, I've seen on television some of the devices, the mnemonic devices that they use now that are able to really talk for them and stuff, which is really good. So at the time we had children that would use head sticks still, to use the devices, and it was very difficult for them.
Yes.
And now the technology's definitely helped them.
Oh, I bet it has.
It's amazing to see what technology's done.
Absolutely.
And especially, I bet in the nursing field too.
Oh, I tell you, technology has exploded. In fact, that is really an area where we work very hard to try to help our students understand that that's something they're going to have to keep up with for the rest of their lives with lifelong learning, is to stay on top of the use of technology and how it influences healthcare, and helping our patients understand how to access information technology and use the technology as well. It's just a huge new explosion of information. And also what we need to have available to teach our students. And that's really been a little bit of a challenge, to keep our skills lab in school up to date with all of the latest equipment, so that we can teach our students in the lab before they go into the hospital, so they have experience with hands-on, and faculty are right there at their side, so that they have a chance to learn the right way and get some tutorial assistance while they're in the laboratory right on campus, so that they can do these activities such as understanding what a patient would be going through, for example, when they were having a cardiac arrest.
Oh, okay.
And we actually have a simulation, Sim Man we call him, and he is hooked up to a computer, and the computer has to be programmed, and you can program in that your patient goes into a cardiac arrest. And then the students would observe this patient, and they first would see the chest go up and down, and they could hear the heart beating, and see the eyes flutter on the simulation man, and the lungs expand, and so forth. And then the next thing you see, the EKG go flat, and you see the changes, and then they have to know what to do, what medications to give the patient, our simulation patient, to help him get better. And it's a fascinating new way to teach students, and actually it's a wonderful way, because way back when I was learning, we didn't have these wonderful tools. We were there at the patient's bedside, and you either had a good experience or a not so good experience, but you didn't have the opportunity to see what each medication did and how it.
So they administer the medication.
They can administer the medication,
and the computer then simulates what
the changes in the patient. Exactly.
Wow.
So it's really
that's so cool.
fascinating way to teach your students. Wow. The students love it, absolutely love it, and it gives them a chance to really see it, do it, understand it, talk about it, go back over it if they didn't see something that they understood, and so forth.
Is this lab on campus?
On campus, yes, right at UCF. And we've really been very fortunate, been able to keep up with most of the latest and greatest opportunities and equipment out there to teach our students.
I would love to come.
Well, you have to come over and see this.
Yeah, I would.
Yes.
I'm serious. I would
Yes.
love to come see this, because this is so exciting.
It is exciting, and actually one of the fun things that we've started to do just a little bit is work with some of the students in micromolecular biology, where they're learning about physiology and what does it mean to have an erratic heart rate. And then we say, okay, now students who are in these other hard sciences, come see our Sim Man and let us show you what it's really like when you think about a heart rate changing, what happens in the patient. And so they can translate that information into real life examples with the patient. And so they have a chance to really understand the physiology in the heart and the patient perspective of what's happening. And so that's a wonderful opportunity to come together in a way we've never done before at UCF.
Who maintains the SIM-Man?
I have a full-time lab coordinator who does just a fabulous job, and she's a nurse, master's prepared, excellent nurse who has had incredible experience working critical care, and she was on the flight team with Florida Hospital. And so she's got a great background, and she loves the lab, and so she maintains the lab and all the equipment, and she constantly tells me what we need to be buying and having available for our students. We have other kinds of we have Simulation Baby, a little baby that we can simulate activities with. We have another Simulation Mother that delivers a baby. And so our students can then see a delivery.
This is so exciting.
A mock delivery.
I never even knew UCF had this.
We do. It's wonderful. And so
You need to advertise that more.
Okay.
I'm serious.
All right.
Because
it is a highlight when I take people on the tour of the school to come see our lab, to have a chance to see where we really do the hands-on work, and it's set up just like a great big ward with lots of beds and the equipment that you'd see in a hospital, the IVs and all of the other, it's called a crash cart, the big cart that has all the medications on it. If a patient was having a problem and you needed to run the cart to the bedside. So we have everything right there, suction machines and simulation of oxygen delivery.
This is so exciting.
Yeah, so we really spend a lot of time with the students in the laboratory, getting them up to speed on all of their different techniques and activities that they need to then use when they get into an acute care setting.
Well, they have to have so many hours, don't they?
They do.
Practicum hours before
Absolutely.
they get their degree and stuff.
Exactly.
So I know in speech pathology we had to have so many, like 400, 500 something hours.
I was going to say we're close to like 500-600 hours.
Yeah, that's what I thought.
And it's a variety of hours. So some is in the lab, a lot is out in the community, where our students actually spend a lot of time with folks in senior centers and other kinds of locations where we really go out and we recognize that our patients our clients are all over. They're not just in hospitals. And it's important to embrace, we believe, at UCF, a very broad approach to the patient or the client and understanding them within their community, not just a patient in a hospital bed.
Right.
And,
not just seeing them
and to appreciate these days, especially where patients are sicker in the hospital, but they leave faster. And then they go home and they need to be referred to other rehabilitation services or long-term care facilities. And so we want our students to be ready to understand and care for those clients and patients wherever they are.
So not just in the hospitals or anything, but outside of the hospital.
Exactly.
Oh, that's good.
So it's really that's
definitely needed.
It's definitely needed, and we found it to be a very important aspect to teach nursing, is to understand that we look at community from a very broad perspective, and all that we need to teach our students and need to take them to multiple places. And so in order to do that kind of an experience, we've had what we call community nursing centers. We have 14 locations with students in our Orlando campus site. I have students in the Cocoa area and take classes here at Brevard Community College. And then we're getting ready to open a site in Daytona at Daytona Beach Community College, our UCF facility. We're going to open this spring and teach basic nursing.
Wow,
as
so you
well.
are really
So we're
expanding with some satellite programs.
We really are trying to meet the
super.
need, given the fact that the nursing shortage is here and it's projected to grow exponentially in the next few years. They're saying by 2020 we'll need about 60,000 more nurses in the state of Florida. So that's a pretty daunting number.
Yeah, that's quite a few.
We certainly can't do all of that at UCF, but we're doing everything we can to be responsive. And so we've opened some new sites, such as Daytona. We've also looked at other models of education, such as an accelerated program. We now welcome into a special group of a class of students, a group of folks who already have college degrees. And these are individuals who have a degree in English or science or history or whatever, and they've decided they want to be nurses.
Just like after
After
like going back to school or something, like after like the kids are gone, or after,
or whatever, or they got a
interesting.
degree in history and said, gee, I thought I wanted to be a history teacher, for example, but you know, that's really not fulfilling for me right now. I'm realizing I need to be doing something else, and so I'd really like to go into nursing.
And that should help with the nursing shortage too. Instead of just getting the young people that want to be nurses, then you're getting some older individuals that are more mature.
You're
probably,
absolutely correct, and that really.
And that's probably what you need in that field is somebody that is more mature, but
you're
been
absolutely
through school
right.
already.
It's a very interesting group of students,
wow.
And so they already have a college degree, and they come in and they go through our program a little bit faster than our regular basic baccalaureate students who are getting the degree for the first time. And so we started that a couple of years ago, and this past summer we expanded that program from accepting 44 students to accepting 60 students. So we do that in a summer admission cycle. And then those students finish in a year. So they come in one summer and then they finish the following summer.
Because they've had all the core classes. They just need to take the nursing classes and just understand
and learn about nursing.
Right.
Exactly. And as you said,
that's so
they're more mature.
That's excellent.
They're a little bit older, and so they can get through the educational process just a little bit easier.
And they can handle the sciences,
That's
if
right.
they've been through some science already.
Absolutely.
And stuff.
Absolutely. So that's been a really wonderful way that we've been able to meet the need. And so that's a new group of students that we've accepted in the last few years. As I said, we're opening Daytona in the spring, and we're excited to do that. We've been in the Daytona area with our RN to BSN program, RN to MSN program, and now we've realized that it was such a huge need to have baccalaureate prepared nurses in that area as well, that we wanted to have on-site classes for the basic BSN students.
That's great.
So we're in the process of getting ready to do that for the first time this spring. So that'll be very exciting to bring in our first class there this January. We've had a class at Brevard Community College at our UCF facility for the last, I want to say, about 4 years. And that's been a wonderful opportunity to be present in the greater Cocoa-Brevard area. And that program is doing very well. And as I said, we've started the accelerated group, and then we've expanded our population in Orlando, where we took in the past 96 students in the fall to our basic baccalaureate group. We're now taking in 120.
Oh, you've increased. Wow.
So we've really increased.
Yeah.
Yes, and that's just brand new nurses, bringing in students to be the brand new nurses. That doesn't even touch on our master's program.
Wow, that's great.
So really trying to expand and meet the needs. But as you can well imagine, all those folks have to get into the laboratory and learn on SimMan.
Right.
So our laboratory...
And the laboratories are mostly at the main campus?
Well,
do you have some laboratories?
Laboratory on the others as well.
Good.
We have a laboratory, skills laboratory in Cocoa, and we're building one in Daytona right now.
I can't wait to come by and check it out.
Oh, good. I can't wait to show you.
It sounds exciting, especially the technology part of it. I would be so
It really
excited
is fun.
about it.
I have to share with you this summer, I had a wonderful opportunity to bring a group of inner city children in to hear a little bit about nursing. And part of the tour was to come to our laboratory, and we had the opportunity to show them how SimMan worked. Well, they were just aghast when they saw this simulation man with the eyes blinking and the chest going up and down, and they just couldn't believe it. But we really wanted to show them, some of the things that we do and some of the teaching tools that we have. And if we spurred a few of those wonderful little children into becoming nurses, then wonderful. Then we've done our job. Trying to help them.
You're definitely meeting a lot of the needs from inspiring a little kid to, expanding it beyond other careers.
We are trying.
That's excellent.
It is, and that's what makes it really exciting, is to have all these opportunities to reach out. We've expanded our master's program. We prepare nurse practitioners, pediatric nurse practitioners, and adult nurse practitioners, and family nurse practitioners, clinical nurse specialists who work predominantly in the hospital, and nursing leadership and management at the master's level. And then this past year, we are instituting 2 new master's tracks, one to become a nurse educator. And I was talking with you earlier about the fact that that course of studies is totally online.
So
that makes it very accessible. And then a brand new track that's being discussed and opened nationwide called a clinical nurse leader. And that's a person prepared with a master's degree to work predominantly in an acute care setting like a hospital, to be at the bedside. So not so much the administrator, but someone at the bedside with leadership capabilities to lead a team and to lead a group of healthcare workers. And so
is it like a mediator between the doctor and the nurses, or bring them all together?
Bring them together, be right on top of, be involved in patient care, be involved in the planning and looking at cost-benefit ratio related to the interventions that are being utilized for the patient. What are the treatments? What are the right treatments? What's the research say about the treatments, to be able to bring that level of
And does it also
knowledge.
do with families too?
Absolutely.
Total, complete.
Exactly.
That's good.
Exactly.
Because I think that's so important too. A lot of people don't realize that.
It really is. It's not just the patient.
Right. It's not just the patient. You can't leave the whole family out, because there's
That's
a lot
right.
that they can bring, especially mentally and physically, to the
Absolutely.
patient.
And really, whatever's happening to that patient is affecting the whole family.
Right.
And so the clinical nurse leader would then hopefully work with the family, work with the other members of the interdisciplinary team, to help them understand what the treatment plan is and what the patient's wishes are and how to best support that patient and their family. So we're excited about this brand new master's program that we're just rolling out this year. And the really fun part about putting this together was that we did it in partnership with hospitals. And the nationwide model was that schools would partner with hospitals, and together you'd work out the plans for the curriculum and the plans for a residency. So the students will be doing a hands-on residency as part of their program, and that we would be working together with the hospitals to do this.
I think UCF does that so well. It definitely brings, the school out to the community.
It does.
It doesn't leave us in a little the Ivy Towers anymore.
Silos, no more silos.
No more siloing.
Right, you cannot do that.
Right.
Absolutely. And so we've had fun actually working with our hospital partners and getting out and around the area, and we want to develop more partnerships. We've worked with Florida Hospital and Orlando Regional, and we've gone up to Halifax and done some work and started some conversations locally with Holmes Regional and some others to talk about this new role and how it would fit into their system, and the fact that we're going to make the education available at UCF, and it's
great.
Almost all online, which makes it again very accessible because those nurses are working.
Right.
You know? And so it's hard to take time off to go back to school.
And to keep up their certifications too.
Exactly.
That helps a lot with the technology to keep up with. Do you do any type of disaster recovery too?
We don't do a lot of that. We're talking about bringing in some more of that into our curriculum, looking more at bioterrorism and all of those issues. We touch on it, we talk about it, but it's not become a major point of emphasis. But we're going to be doing some more with that.
And things that we've now learning with the past hurricanes and stuff, with patients being moved and then their records not going with them, and the doctors not knowing what medications they were on and everything.
You are right. That is a real area that nursing is working hard to help the whole system come together in terms of managing the electronic data, managing systems that perhaps aren't already at the electronic stage yet to facilitate patient care. How can we help the patient? How can we help our clients in the community?
Do you ever think there'll be one day where they'll carry their like medical records in a chip or something? Do you think about that?
I do. I think it's going to happen at some point, don't you?
Yeah, I think so. I think it definitely, I even thought about it should already be in our clothing or like in a bracelet or something that we wear all the time. Like
you work with data management.
Right. I know. I was thinking about this the other day. I was like, it'd be really cool to develop a program to have all your medical records on a chip and then have it like on something that, or if this gets, in a storm or something, this may get torn away, but then maybe have it I wouldn't mind having it embedded in my skin or something. I really would. I know a lot of people think it's kind of weird and futuristic, but I wouldn't mind. If I'm totally unconscious, I would want them to know everything about me.
Right.
Because diabetical bracelets get lost and everything.
That's right. Right, and we certainly have seen evidence of how critical it can be with the most recent hurricane issues. in Louisiana, where you're from originally.
Right, right, and
Yes.
that's what got me started about this, thinking about, and yeah, in my company we develop software that does data management
Now, what
for
kind-
backup. It's mostly data backup programs right now are programmed to back up like at a certain time.
Okay.
Like maybe 3 o'clock or 4 o'clock or 5 o'clock.
Automatically do it?
This one just automatically backs it up. It's embedded in with, it works integrated with like Microsoft Office products, like all the Word, Excel.
So it
products.
automatically backs it up.
In what we call real time.
Right.
In terms of, right when you do it, you hit the button,
And it backs
it
it
backs
up.
it up.
So you're primed to be
I
involved
know,
in this.
I know.
How do we save this medical information, and how do
because
we
this is
keep
really
it current?
And this has really got me thinking about it, especially with all that's going on, that's been going on the past years. And
Absolutely. It's a really interesting time in terms of teaching students with all of the technology in the different hospitals. And this has been an interesting challenge for us to try to keep all of our students current in all of the systems in all of the different locations.
How are you finding your students? Are they technology savvy, or?
They're pretty good.
Oh, okay.
And I think I would say they're similar to your students. They're either really savvy.
Really? You're finding that too?
Or they're not terribly savvy. Now, we probably don't do half of what you do with technology because we're more focused on the patient and learning the skills and being at the bedside and all of that, that we're not heavily into programming the information or working with the the technology with the medical records. I mean, they need to know how to do it, but we don't spend a lot of time on that. But the students need to be ready to move into systems where it's perhaps much more advanced than they might see in the local hospitals or wherever they're doing their practicum.
Are they starting to see that like in the doctor's offices, where a doctor will have like a Palm Pilot or something,
That's
or even
right.
a graphic tablet, and they'll write the information?
They
are they
are.
starting to
They
realize
are.
that that's real important, that they need to be up to speed on that particular technology?
They are. I would say it's very interesting because our brand new students who are learning to be nurses, they realize that's important, but they're very focused on learning the science of nursing, the skills and the abilities and all of that. So they appreciate the importance of the technology, but they're not really doing the hands-on. Now that's much more at our graduate level, where we're seeing, for example, nurse practitioners now are using the Palm, the PDAs, the little Palm held to look up their patient medications and to have data on the medications and current information and right at their fingertips.
So they're more computer savvy. They're becoming
good. And they're more savvy in nursing.
Oh, right.
So they're a little more comfortable.
And they understand why they need the technology.
Exactly.
And I think that happens a lot in my class, is that when the student finally understands why they need this, then they really get into it.
Okay.
But until they understand why they need it, they're going to be very leery about it or intimidated by it.
Really, and I think we're saying the same thing. It's interesting across different disciplines.
I know.
It's sort of when the student can really appreciate the application, that then they can really get much more involved, understanding the technology, and then take it to a new level, and then begin to think about some research that they can do with it, and how they can begin to perhaps take it to a different level where it hasn't been before with their patients. And to introduce their patients into different levels of technology. When I was working with some of my students in a previous job in South Carolina, we were involved in exploring telemedicine and looking into what we could do with telemedicine in the home and teaching our patients how to hook up to the telemed machines and then transmit their biological information into a home base area.
Like their body temperature and their cholesterol, or if they took a cholesterol level, blood pressure.
Blood pressure. Yes.
Wow, that's excellent.
Yes, and I think that's a fascinating area.
Yeah.
Where we're able to do more out into the rural areas and have folks who maybe don't have the ability to get to hospitals or other primary care facilities to be able to then communicate to, say, a nurse practitioner who might be in the next town or in the next office, or a school-based clinic. We were looking into this for some school-based clinics where we had nurse practitioners.
That's excellent.
So
that they're still getting the services that they need without, even if they're in the rural areas. Like, you always think in the rural, poor areas they're not getting their services, but you can still, have those services to them.
Well, you worked out in the rural areas with the handicapped.
Right.
So, I mean, this would be a perfect
example
of what could be done in those rural areas, where if they had an emergency or a need to check in periodically, you know, they could do so, or the family member could do so.
Yeah, like the parents could definitely, you know, take the blood pressure, take the temperature, take everything that they need, put it in,
and transmit it.
Yeah,
And then
that
someone
would be
could
excellent.
be so technology today is fascinating.
Or what about the idea of now that doctors can do surgery that are not even there physically?
That's
they do it like virtual you know, operations. I mean, I find that to be very fascinating.
It is amazing. Yes, it's come such a long way. I know from the surgeries I used to observe when I was a student, you know, way back when I started my nursing career in New York City, to now the non-invasive kinds of testing that can be done. You know, where we used to, when we did open heart in those days, which is a long time ago, and you'd observe and they would open the whole chest. Well, now they don't have to do those kinds of expansive surgeries anymore. You know, they're able to do much smaller suture lines and incisions, and our patients do so much better these days.
I was just watching CNN this morning. They were saying some hospital did a liver transplant without doing a blood transfusion.
It's amazing.
And I was like, wow, they're really, I mean, it's happening.
Changing every